I'm trying to be sensitive of social distancing.
Oh,
okay?
yeah. Yes.
We're good. We're good.
You guys good? Yes. So we're just here saying yes to the census. So many folks are home and we're all making sacrifices for the sake of the short-term health of our community. If we stay home, if we social distance, we're gonna stop the spread of coronavirus. But there's something we can do while we're at home to promote the longer-term health of the community, to ensure that once we get to recovery, that we're gonna have the federal money we need for hospitals, for renters assistance, for schools, transportation, to get our community back on track. All of that will be based on our census count. And so today on Census Day, we're asking everyone to fill out their census. You can continue to fill it out up until August, but today, April 1st, is Census Day, and you can get it done. Takes 5 minutes. It is quick. It's important. It's the last chance we have for the next 10 years. And so you'll be done until 2030 if you fill it out, and it's secure. Under penalty of jail. Nobody can share your responses. So folks can go online, my2020census.gov. There are several murals like this one. The artist is here, and it is such a community-wide effort. This beautiful mural with different colors and the skyline of Houston and the diversity of our city, of our county, just represents what we have to do right now, which is to fill out that census. En español, brevemente, simplemente quiero mencionar que estamos celebrando el Día del Censo. Estamos todos en casa, guardados, haciendo sacrificios por el futuro, la salud de nuestra comunidad. Estamos haciendo esos sacrificios de estar en casa, de estar separados de la demás gente. Y hay algo más que podemos hacer para preparar a nuestra comunidad a largo plazo. Cuando pase este virus, vamos a tener que recuperar nuestra economía, nuestras escuelas, nuestro sistema de salud, y para eso necesitaremos fondos federales. Vamos a necesitar de eso el censo. Toda la distribución de los fondos federales se basan en las cuentas del censo, todo tipo de programas de salud, de escuelas, y hoy es el día del censo. Pueden responderlo hasta agosto, pero siendo hoy, 1 de abril, día del censo nacionalmente, les pido que por favor tomen 5 minutos de su tiempo y lo llenen. El censo les va a preguntar nombre, les va a preguntar si son latinos, de qué país son. No se preocupen, son las preguntas que se hacen desde hace más de 100 años que empezó el censo. No hay por qué asustarse, bajo pena de cárcel. Nadie puede compartir esas respuestas. El gobierno no va a saber, no hay pregunta de ciudadanía, no se va a compartir esas respuestas de manera individual con ninguna otra rama del gobierno. Simplemente lo recibirá el censo, lo agregará y con base a nuestra población nos enviarán los recursos necesarios para seguir adelante. Entonces el censo es seguro, es rápido, y tenemos varios murales como este representando la diversidad del condado Harris, de Houston, y pidiéndole a todos que por favor nos ayuden a llenar el censo día de hoy. Estamos en casa, tomemos 5 minutos, con eso ya nadie los va a molestar a que llenen el censo de aquí al 2030. Esta es la última oportunidad que tenemos para llenarlo para los próximos 10 años, para recibir los servicios que merecemos por los próximos 10 años. Thank you so much. Mayor Turner is here as well.
Thank you, Judge. And again, this is April 1st, Census Day today. And I want to echo what Judge Lena Hidalgo had to say. And I know it doesn't take very long because I filled out the census online today. Went online, did it. Took me less than, seemed like 3 or 4 minutes. So it's not a complicated process. I want to encourage everyone to do it. We're right out here today in the Montrose area. And one of the reasons is because 66% of the people in the Montrose areas are renters, 66%. And that is a difficult group to count. That's why we're out here in Montrose. You got this mural. And that's one reason. Number 2, there are a lot of people who move in and out. And in the last 5 years, right here in this area, you're looking at a population of about 30% of the people in this area compared to 17% across the city. So when it comes to renters and people who are moving, a very difficult community to count. And then this is a culturally diverse area. LGBTQ community and so many others, people of faith, all ethnicities, languages, whether you're documented or undocumented, it really does not matter. If you are a living being, okay, if you're a living being in the city of Houston, it doesn't matter whether you're a citizen of the United States or not. If you are living and you are living in Houston, Harris County, we need you to do the census. And Judge Hidalgo and I have a little friendly competition to see which geographical unit can get more people registered. As of today, Harris County has gotten 32% of its people to go online. The city of Houston is at 30.1. Now, I love Judge Hidalgo, but Houston, come on now. So let me ask Houstonians, today, go online, fill out the census, because we're in a competition with Harris County. And at the end of this process, I certainly would love to have the bragging rights, So please respond to the census. And what does it mean? In a healthcare crisis, you need the dollars. You need the money. And so by filling out the census, you help us to pull down the money. More parks, libraries, green space, you name it, university grants, colleges, our kids, transportation, streets. So you have to fill out the census. And so please do that. Please be important. If you do it online, people don't have to come and you don't have to fill out anything in the mail. People don't have to come knock on your doors if you do it online. And again, I want to say it doesn't matter who you are. Every single person. This is not about ICE. Okay, this is about filling out the census. Please do that. And so, lastly, on a humorous note, Judge, being bilingual, I think that is so cool. I want to be able to do just what you did every single night at the Influence. Since now I got my free evenings are free. I got all my tapes, and I'm teaching myself Spanish. I think it's just so cool. So I want to be able to do my stuff in English and then do my own little translation. So I'm working on it at night, and I'm making some progress. Okay. So, but it speaks to the diversity, the cultural diversity of our city, and we have to be able to speak to them where they are. Just like the census, we wanted people to fill out the census, regardless of who you are. We invite you to be a part of the process. You're in our city. We both represent you, no matter where you come from, whether you're a citizen or not. If you're in Harris County, you're represented. If you're in the city of Houston, you're represented. Now come join us and be a part of the process. Thank you, Judge.
Thank you.
¿Cómo estás?
Sí. Sí, así es, sí al censo. Muy bien, ¿cómo está? Bien. Any questions?
So I have a quick question.
One second.
Oh, yes.
Houston, actually.
Yes, thank you.
Hi, good afternoon, and thank you for this opportunity to speak about the census. My name is Nabila Mansour. I am the co-chair of the Community Subcommittee of the City of Houston and Harris County's Complete Count Committee. I also chair the Census Working Group with Houston in Action, and I'm the director at MGAGE and ECI, a collaborative Asian American organizations doing the work for the census here in our city, in our county. So I'm excited to be with you here today on Census Day, April 1st. I want to thank you, Judge and Mayor, for taking the time today to remind all of our residents about the critical role they have in responding to the census. And as the co-chairs of the various communities and subcommittees have been having conversations around census and COVID-19, we do agree on one thing, and that is that our top priority is to keep our members, partners, our communities safe and strong. And we understand that in light of COVID-19, we have to rethink some of the ways that we are going to work toward a complete count. Houston in Action and members like MGAGE and ECI have been coordinating our work over the census for over a year. And because of that work, we are well positioned to lean into the many trusted relationships we have built over the last year and a half in preparation for this moment. Those relationships that we built are still here. That dialogue is still current, and our plans are still in place. We are committed to counting and empowering our communities to complete the census. In my role as director at MGage, we work with the Muslim American community to ensure they civically participate in every aspect of American life. And the census is no different. The questions they ask are no different than the questions that all of us are asking. Whether it be, do I include a college student that's in my household right now when she is no longer living on the campus on the form? Or whether it be about including the aunt that is visiting, that can't go back to Bangladesh and is riding out the strange time that we are living with us right now. Well, we have operators on standby to take questions in English, Chinese, Vietnamese, Spanish, Korean, and Urdu at our local census support hotline at 281-305-8300. And it is open and available to answer any concerns or questions regarding the census. So that's 281-305-8300. Our tactics may have changed, but our strategy has not. We are still relying on trusted voices in our community to make sure our communities have reliable, accurate information so that they are counted in the 2020 census. The census is an important way to make sure we are all seen and we are all heard. Many of us in the city and county are immigrants, are non-citizens, undocumented, and we understand that we have been here before. We have oftentimes found ourselves at the margins, but we are resilient, we are organized, and as in the past, we find ways to push through and make our voice heard. So for those of you at home right now, please know it has never been easier to respond to the census from the safety of your own home. You can visit my2020census.gov right now and complete the census. It is 9 questions. It takes less than 10 minutes. So that's my2020census.gov. So, thank you. So, check in on your neighbors, your family members, and make sure they're healthy and safe. Happy Census Day, happy Census Week, and please remember to say yes to the census and make sure that H-Town counts. Thank you.
All right. Thank you so much. Thank you.
So I was just wondering, is this one of the 5 murals around Harris County or in Houston City?
We have 5 murals, I believe, in the city. Nabila, correct me if I'm wrong. Yes, so they're in the city, and they're all, what folks were explaining is it's a snapshot in time. So this mural, you can see it's a reel, you know, and the other ones, it's a Polaroid shot. It's trying to capture the fact that it's a snapshot of our community. That's what the census is. Now, we had canvassers that were going to be visiting door to door in the city and in Harris County to ensure that folks filled out their census. Now, we can't go door to door anymore because of the coronavirus. So instead, all of these canvassers are now phone bankers, and they're doing text messaging. And so, you know, that look out for that. They will not bother you if you fill it out. And then, of course, we need to be safe. So all these folks are calling people to remind them to respond to the census. Nobody is calling to ask for your information. So if somebody calls asking for your personal information, that is not an official census person, census worker. They are only calling to remind you and tell you how to fill it out, and you do it by yourself on my2020census.gov. You can do it on the phone through the census line that's on their website, on the postcard you received. And if you don't fill it out that way, you will receive a letter at some point. But let's get it out today. Let's get it done today, and that way we don't have to think about it for 10 more years. All right.
Can we talk about something?
Last thing, certainly want to acknowledge our artist, Mr. Dees.
Yes.
Thank you so very,
Thank
very
you.
much. Wonderful job, man.
Thank you.
And this pops out at you. I love the colors, bright, you know, and especially when we're dealing with COVID, we kind of need this. So, so thank you very, very much. Very creative.
Thank you. Yes.
Judge, from both KHOU and from Ted O'Rourke, they wanted to know more about the release today. Do you know when the trail releases will begin? And for those who are concerned about these folks perhaps committing crime once they're out, what kind of assurances do you give these folks?
So remember, and I just signed the order this morning to release non-violent folks from the jail, and it was a decision that was necessary for the health and safety of the community. The jail is a ticking time bomb. We've got, at this point, around 8,000 inmates. And if they get sick, these are the folks that will be taking up your hospital bed that you need, your respirator, your doctor. So we need to ensure that we don't have such a high concentration of people in close contact. There already is a case in the jail. There's already over 1,000 people that are attempted to be quarantined, but there's simply no room in the jail for quarantine. And so what the healthcare experts had told us, and common sense as well, we have these folks all close together. It's a big danger, not just to them, not just to the 3,000 doctors and law enforcement folks that work in the jail, but also for the entire community once these folks get sick. And so what we have to do is reduce that population as much as possible. We are, of course, working on moving some of the folks out to the jail to other facilities. That takes some time because you have to secure the facilities. And then for the nonviolent folks, and there were certain carve-outs of nonviolence that were even left out, but these are people who've been accused of nonviolent crimes. They have not yet been found guilty, and we are going through a process to release them, but before that, to do a background check on each of them, ensure there's no violent background, ensure that they have a place to live, that they don't have COVID symptoms. The process, we hope, will be done, we'll be able to start releasing here in the next couple of days, because it is a ticking time bomb. Every day that goes by, that person who's COVID positive, the other 20 some odd people who have symptoms, and the 1,000 people who've been exposed to all these folks, they are still in the jail in very close contact. And remember, we only have about 4,000 beds in our region that can sustain, that are free right now, that can sustain people needing intensive care, and we have 8,000 people in the jail in very close quarters. So it's quite a dangerous situation that we got to get done as soon as possible, and it's just a matter of working through the process.
Do you think people get released starting tonight?
I don't expect necessarily tonight, but our question is to go through the process, and as soon as we've done the due diligence, then we can release. Right now, and already for the last couple of days, our criminal justice stakeholders have been reviewing the backgrounds of these folks, and so if they can get the review done and everything can get processed, then perhaps we can get it done today. And again, they'll be enforcing conditions if it's an ankle monitor, a breathalyzer, other conditions to ensure we're safe. But it is a necessary decision, because if we don't do this, we are certain to have, we know we're going to have an outbreak at the jail. We already have a case. We already have people infected. And the question is, do 8,000 people get sick? Do fewer than that get sick? We will be releasing around 1,000. Again, we have to review each person, so the number may be smaller after we do the review. And then we are transferring, we hope, a couple of thousand other people. And other than that, with the space we've left, try to space people out so that we don't all of a sudden find ourselves with Italy in our hands or New York in our hands, just coming out of our county jail downtown. It is not a problem that stays at the jail. It's something that they will need a hospital bed, and they will need your hospital bed. So we need to stop there from being an outbreak.
And also, what is your reaction to Hoaxy and some of those other folks filing a lawsuit against you? And obviously, the governor came out with exemptions for churches, saying it violates personal human rights.
Yeah, so there has been a lawsuit filed around some of our portion of our stay-at-home order. I obviously can't comment on ongoing litigation, other than to say, just as my order on the jail abides by the governor's comments that no violent criminals should be released. Of course, we are not releasing any violent criminals. Same with everything else. We are working with the governor's office as we speak, with other communities around the state right to understand what his order says, and our guidance has been based on public safety. It's entirely based on we need to stop there from being close contact, and that's what's going to help us get through this virus. Already, we've seen so many, the vast majority, I would say close to 100% of faith leaders that have taken their services online and that have told us that they will continue to do that. And so I'm grateful for that, because the reality of it is that's what we need, and we do ask that folks continue to do that. We will abide by the governor's order always, and within that we ask, continue to stay home. This is not the time to relax our social distancing. Just today we will be announcing, and I can say right now, we have found that today the Harris County's case count outside of the city is growing by 86 cases in just one day. So that puts us, with added to the city, will be well over 700 cases, perhaps into the 800 number for Harris County. The hospital leaders tell us that the rate is growing still too fast, and so right now is the time to double down on social distancing to make sure we're minimizing the possibility that we're going to see an outbreak where all of a sudden thousands of people are going to need hospital beds. And also everything, every activity, it should not be taking place if it brings people in close contact.
So 86 new cases today?
86 new cases. As you know, we announce them usually at 4 p.m., but since I'm here, I figured I'll just share. So Harris County, outside of the city of Houston, has 86. Of course, the city may have had their own case count updated as well.
That's what I was wondering is, Mayor, I understand you probably have some updates about case counts and other incidents.
Yeah, I know we're adding, I want to say about 81. We're adding 81 new cases today. I think that will bring our number up today to somewhere close to 477. 458. Okay, to 4. So we adding 81 today. That brings the count up to 451. 458. And again, we're expecting the numbers to rise, and that's why it's just so important to reinforce what the judge said about the practices and what we're asking people to do in terms of social distancing. This is not the time to lessen our resolve in this crisis. The numbers, as we do more testing and more people are doing testing beyond Harris County and the city of Houston, and as we get those results back, the numbers are going to continue to rise, and so we have to do everything we can to flatten the curve. I will say, as relate to the faith-based communities, it was just last week I got a call that there were 2 members of a choir in one of our local churches here that was tested positively for COVID-19. So churches, institutions are not immune. They're simply not immune. And I want to applaud the faith-based community for working with us almost at 100%. And I'm hoping that they will continue to do just that.
So you said a church choir?
There were two members.
2 members
of the church choir.
You think they got it during rehearsal or something?
We don't know, but there were 2 cases. That's in one church. There was another church choir, and I'm in these churches all the time. Also came down and was tested positively. And these are members coming from the church, from churches, 2 different churches, and I'm sure that there are others. So nobody is exempted. This virus is not asking whether you're in school, at a business, in a worship center. It really doesn't matter. And I think there are many ways that we can worship, but we can do it in a much safer environment. But we're all on the same team, and this is not a situation as if they're different teams. We're all on the same team, and in order for us to be successful, all of the players on the team have to be moving in the same direction, and we can't be at odds with one another and prevail.
Have you guys also heard, in Austin they had a bunch of spring breakers having like sort of a group issue where a bunch of them got, because they all travel together. Have you guys heard any similar incidents here in Harris and Houston of spring breakers coming back?
I'm not heard that, but with very porous geographical boundaries, people are traveling all over and then they're returning. Again, what we're saying to people is that be careful where you go, and if you're traveling outside the state of Texas, you certainly need to quarantine when you come back. But it's a very We are traveling all over the place. And that's why, to the extent, if you're not in essential business, people need to be staying home or remaining in the proximity of their home or going to the park. But whatever you do, engage in social distancing.
And what about fatalities? Are there any additional fatalities?
For today, no fatalities in the city of Houston, other than the 80, again, I keep forgetting the number, the 81 cases that have been reported. The number of fatalities in the city of Houston stays at 4. So no fatalities over the last 24 hours, which is a good thing, okay? But again, let's flatten the curve. We have to stay within our hospital healthcare delivery system ability to handle the cases. So flatten the curves. I'm not so much surprised and amazed by the increase in numbers. That's expected. But if the numbers are such that the healthcare delivery system can handle all of the patients that need a hospital bed or an ICU bed, then we are good. If the numbers are spread out over 2 to 3 months, that's fine. But we have to do everything we can to flatten the curve. And if we are successful at doing that, then that's a win for everybody.
So don't play basketball.
Huh?
Don't play basketball.
No, the rims on the basketball courts are coming down. They're already, as much as, we all like to play. That's a physical contact sport. And unfortunately, I've given instructions for the rims to be taken down.
So Mayor, can you repeat that for my sister Anna, who's a basketball player? Repeat just what you said for her, please.
Right, you want me to do it in Spanish or in English?
En español, si puede, I'll be proud. No basketball.
Well, I was about to do it, but I'm not trying to show off. Judge Hidalgo, if you will come and
All right, just so you don't have to show off.
Yeah.
Entonces ha dicho el alcalde que no es el momento de estar jugando básquetbol. Ese es un deporte de contacto. De hecho, la ciudad está removiendo los aros del básquetbol, todo eso para que nadie esté jugando ningún tipo de deporte de contacto. Y no solo el básquetbol, fútbol, frisbee, nada de eso, porque están muy cerca otras personas y además están pasando un objeto. Tocan el objeto, se tocan la boca. Por favor, ayúdennos a que no esparza este virus.
And I will say, people are saying, okay, what can we do? We've got spare time, people at home, people out of school. I would tell you, for me, the one thing that I'm trying to do is trying to be more bilingual. So that's what I have singled out for me. So in the evening times when I go home, since I'm not going to a banquet or a town hall meeting or some civic association or talking with people, when I leave home, I've got all my little tapes and stuff, and all my televisions are pretty much on one station. And I'm just trying, it's immersion by one. And so the goal is to teach myself, when this virus is over, then just ask me your questions in Spanish and see just how well I have done. See.
All right, thank you so much. Gracias, thank you. Dígame. Ay.
Rafael me dijo que me hablamos.